So, welcome to the Global Diabetes Insights, where we are here to talk about something very, very crucial, something that we have always been dealing with, maybe from whether from healthcare professional perspective, people living with diabetes. But I believe this is a topic that is really crucial because it's under researched. But I think it's something that we really should be talking about, where we're talking about tackling an issue that should not just be as simple, but something that should become like these major barriers that we have for people living with diabetes, navigating airport security with life-sustaining medical devices. I've had so many times when people were asked to remove their medical devices. But yeah, I think we're going to discuss more, to jump into it, to dive deeper into it, and share from our lived experience, from our research perspective, from healthcare professionals that I have here with me. So, without further ado, I would like to ask you both to introduce yourself. Maybe we'll start with Belinda. If you could introduce yourself briefly.
Thanks, Tino. My name's Belinda. I'm based in Victoria, Australia. I work as a nurse, midwife, and diabetes educator, and currently work in an Aboriginal community controlled health organisation, which is basically primary care. So I look after people with all types of diabetes: type 1, type 2, gestational diabetes, pre-diabetes. Do work on a nationwide ASH glucose study as well with the type 2 population. I'm trying to understand if sensors reduce HbA1cs for people with type 2 diabetes. In my spare time, do get fairly involved with a lot of diabetes advocacy work, because I think as health professionals, one of the biggest roles that we have is to advocate for people with chronic conditions in regards to how to navigate the healthcare system, policies, systems and services, especially given so many of those things aren't designed with them in mind. We're getting better at it, but we've still got a long way to go.
Thank you for that. Maybe we jump straight to Lauren, if you may.
Yes. So my name's Lauren. I have been living with type 1 diabetes for, I think it's 7 years. My mum also has type 1 diabetes, so I've kind of grown up with diabetes being a big part of my life for a very long time. But my diabetes diagnosis, that although it was later in life, it's actually been one of the best things that's ever happened to me, because I now work in the diabetes kind of space. I'm not a clinician. I am the health promotion and communications manager at PDC Health Hub, which is a private diabetes community clinic in WA. So I'm from Perth in WA, and it's an amazing team. It's a multidisciplinary allied health team. So they've kind of pretty much got everyone you need for your diabetes care all under one roof in the clinic. And I lead a team which looks after things like stakeholder and community engagement. We run lots of events. I support the peer support and social prescribing groups that PDC offers, making resources, marketing type stuff. Just yeah, really heavy on like engaging with the diabetes community, supporting the diabetes community, which has led me to advocacy projects like this one. So where there's a need for the diabetes community, we show up, and that's what we do. Airport security and diabetes devices, because that's what we were hearing from the community, what they needed. So here I am.
Thank you so much. And I believe that across Australia and globally, it is the voices of the diabetes community that continue to highlight just how urgent these issues needs to be fixed, because they deserve that. They deserve our immediate attention, because if it's something that is not proper, we challenge it. We challenge the narrative so that we hope to create a better path, a smooth or a good narrative that people living with diabetes or whatever healthcare condition should feel supported and not feel like they live with a burden. Yes, of course, it's a burden, but then they should not be put into those critical or maybe those weird situations where they're asked to remove their medical, or maybe to be asked to pull out maybe a letter from your doctor to say, does she really live with diabetes? Does he really live with diabetes? That kind of a thing. I think we've seen all those. So I believe that in this conversation, we're going to, as we bring people living with diabetes, and also from the clinical perspective, Belinda, the systems expertise that you have been going through, things that you've researched, things that you've experienced, things that you've been talking about, especially as a researcher yourself. So I think we are going to talk about to unpack all those things like what's going wrong, how can we do, what should we do, what is available so that we could challenge this narrative, and what can the diabetes community, what can the world do to help support that so that people living with any healthcare condition, but in this case, type 1 diabetes or any sort of diabetes, would feel supported and will not feel like, oh, maybe it's unsafe for us to travel with this medical device if I'm going to a global community or if I'm going to a different country. So I think that's just amazing. So thank you so much for joining this podcast to share expertise and your time, your effort, and everything that you do. So my first question would be talking about something that is really critical. So yeah, so I think maybe if you could share with us briefly, like why has the airport security become such a major issue for people with diabetes, especially those using devices like pumps, CGMs?
I came into this world because we were hearing from our community members that people were being forced to go through airport security, like body scanners, but they didn't know whether that was safe or not. And whereas they previously told can't go through X-ray machines or can't go through certain machines, and then these new technologies are coming out, and airport security staff are saying, yeah, you can go through, that's fine. But there's so much that we don't know about diabetes technologies and whether they're safe to go through these things or not. And it's new. And people wear these devices, and like if someone's wearing an insulin pump and something goes wrong and they're going on a long haul flight, if they don't have their backup pens or something with them in their carry-on, that can be deadly for them. Within hours, they could be seriously sick. Worse by the fact that we have manufacturers telling us all different things around what we can and can't do with our diabetes devices going through airport security as well. So some will say, yes, you can do that. Others will say, no, you can't. There's community members in online forums saying, yes, totally fine to do that. I've been through that. That's okay. Other people don't know. Other people have negative experiences. There's so much happening that it's basically people like going through airport security, not knowing whether it's okay. Just because we have diabetes doesn't mean that we should be having to advocate so hard to do something that we should all be able to do, which is to travel.
Thank you for that. I don't know, maybe before I comment, Belinda, would you like to add anything or something about that? Or should I ask you a fresh question?
That's actually what started our project here in Australia. So it was in August 2022. I was sitting down in the Brisbane airport coming back from National Diabetes Conference, ADC. I'm not on social media now, but at the time I was. See health professionals, as well as lived experience delegates leaving the conference, and you could see them literally having just gone through airport security, going back to their home states and territories, and they were posting their experiences of trying to move through airport security. And most of those posts were of a negative experience, an overwhelming experience, a fear-driven experience, experiences that just evoked so much distress and discrimination. So I just thought, bugger this, opened up my laptop literally in the food court of Brisbane Airport, typed up a blanket email, sent it to the individual airports around the major cities of Australia: Perth, Darwin, Adelaide, Brisbane, Sydney, Melbourne, and Canberra and Hobart. And probably within 3 months got back 4 replies from some of those airports. The nature of the email was to offer diabetes education basically, but delivered to airport security personnel. So the emails had gone off to the airport departments in hope that it would reach the right person. So 4 of those airports had gotten back and said, yeah, let's take this further, let's discuss it. And then that opened up, I'm not sure this podcast would have time to talk about, opened up a 4-year project.
Did we know how much it would explode?
Yeah. But it's a good explosion. It's an explosion that needed to happen. It's had the ebbs and flows, like a CGM trace that has a glucovariability of 56%. Lots of ups and downs. We've had wins, we've had losses, we've made friends, we've made enemies, but all the right people have stuck by the project. At the end of the day, we do have now all the right voices at the table.
One of the things that's really triggered for even for me to get interested in maybe doing a podcast in this area. I think I remember one time, Belinda, when you shared a video of this young boy, I think it was shared in Australia on the news. It raised so much eyebrows. And I think from that, so I think maybe it's one of those stories. If had those things not been shared publicly, I don't think there would have been much attention because there's something that could have triggered something for something to happen, right? For any sort of advocacy to happen, even for people to start campaigning, you would have noticed something that you say, this is not right. In my eyes, I've seen a person who was actually asked to remove a CGM, considering how expensive it is, coming from Africa because you need to order these things from the first world countries. And I remember there were times whenever I travel, that's when I say, okay, I need to package as much as I can to bring as many CGMs as I can so that when I come back to Zimbabwe, I don't have to struggle because I'm on a hybrid closed loop now. So, but maybe I would want us to talk about briefly, what do you think, like, what are the stories from the community that highlight the agents of addressing this problem? Because I know that you are researching about this issue, and I believe hopefully soon there's going to be a journal, there's going to be something shared, but I think I would want us to talk about that briefly, like the stories that from the community that highlight the agents of this, of addressing this problem.
So one of the members on our National Working Party has type 1 diabetes. They're also a diabetes educator, and their main motivation to becoming involved was not because they're a diabetes educator, it's because they are actually scared to death to travel themselves because they've had real world experiences themselves of being treated absolutely unnecessary distress and discrimination. Like it was traumatizing for them. And that might come across to people who don't understand how traumatizing it is as just get over it sort of a thing. But that trauma is so real, and we have to acknowledge that. Yeah, so that's her motivation for being involved in the Working Party. But also just, so that little child, that was on the Australian Current Affair, ACA in Australia, it must have been August 23. But anyway, it was about, I think he was about 8, and they'd flown from Adelaide to Melbourne for a wedding, family wedding. Adelaide to Melbourne, they had no problem. So that airport was fine. And this is what Lauren has found with the many community members that she's been working with. But then Melbourne back to Adelaide, there was huge problems. And they literally kept him at the gate until he was in tears, as was his parents. His mum was in tears and his dad was ready to kill someone, understandably. They literally were trying to make him take off his Dexcom CGM and his pump. And they actually kept him at the gate in tears, not in a private room, not like publicly.
Hmm.
Yeah.
Wow, that's sad. I don't know, Lauren, would you want to
I
add
mean,
something?
what more stories do you need?
Yeah, I mean
Yeah,
that's a
so
trigger. That's a trigger.
I know of plenty of stories where people have had difficulties going through. One that comes to mind is unfortunately quite recently at Perth, someone went through, they were wearing a T-slim pump. I think they were asked to remove their pump and they refused to do that. So there was a bit of a pushback between the security staff and the passenger, arguing about what was to happen, and then supervisors were called, and meanwhile, like their stuff's traveling somewhere down the conveyor belt where it's being scanned and is waiting to be collected. I think eventually, like a pat down was had. I've heard of people who are forced to have pat downs in the like completely public area, not in a private room or anything, despite that being requested. But anyway, pat down was had, that was sorted. I think they took the pump off them to do like an external swab to test it. And then when they brought the pump back, in that time, someone else who was also using a T-slim who was behind them had done the same thing. They'd removed their pump, sent it off for a screening. And so they came back with 2 pumps. So this first passenger had received their pump, but then they were offered the second passenger's pump as well. And they nearly went to take it thinking, oh yeah, that's a T-slim, that's my pump, even though they were back wearing theirs again. Like, what are the odds that like 2 people with diabetes are traveling through, they're both wearing the same pump, and someone's nearly walked off with 2 pumps, someone's nearly lost their pump? Like, that's a really real risk, like traveling through airport security, like that, yeah, something might happen to their pump. And they shouldn't be having to take their pump off to get through airport security either.
That type 1 diabetes is increasing across the globe. And also when we do have more countries that funding pumps, we've got the UK funding pumps through the government, we've got New Zealand funding pumps, we are hopeful that Australia will follow soon, and hopefully that just keeps leading on to more and more countries funding pumps, so more people will have access. It is going to be incredibly common seeing people with diabetes technology. I would love to see less diabetes,
Wow,
but
that's a fact.
I don't think that's a reality
Yeah.
anytime soon.
Yes,
I
And
really
hopefully
don't think it is.
more people who have type 2 and other forms of diabetes who can wear CGMs and pumps. And then
yeah.
that's even more people that are going to be coming through with these technologies. So we can only hope that we will see more of it because we want more people to be able to access this life-saving and life-changing technology. But there's a lot of work to be done in the airport space in the meantime.
Yes, talking about airport security has been the most critical because almost everyone has to go through it. You cannot hide it, even if you hide it under your sleeve, it'll be detected. And also, we don't have to be going through such body scanners, full body scanners, X-rays, which is something that we're going to talk about soon. In Africa, it's not really a thing because not everyone, maybe 1 in a million people will be using these medical devices. And then people will be raised eyebrows and then they'll be like, come on, what is this? What are you talking about? It's really weird because it's in Africa, something that I'm going to be talking about soon. First question that I have for Belinda, you as a clinician, what do you think, what are the critical gaps identify that led to Australia's national project that we are talking about now?
One of the major gaps is lack of awareness, particularly with airport security. We're not blaming airport security to not know about pumps. Like, diabetes is a challenging condition. People who are in the know, the technology is always increasing, it's always updating. We've got more and more CGMs coming out. We've got more and more pumps coming out. We've got more hybrid closed loop systems doing different things. We've got do-it-yourself pumps as well. So that's, again, going back to why we sent that initial email to all of the airports across Australia, just offering them some diabetes education to help them upskill because it hadn't been done before. Airport security, will churn out policies on how to manage hidden disabilities, but that's not just insulin pumps. That might be a stoma bag for someone who has a stoma post bowel cancer or something. It might be a pacemaker. Might be a cochlear implant. So they've got their hidden disability policies for airports, but that also includes pumps. So it is hard for them to be across all your different medical devices and then understand how your individuals want to be managed. So it was about trying to raise their awareness about what technologies do and don't, can and cannot do, but also helping them understand that different individuals using these technologies will have different preferences. So it's about balancing what the diabetes technology can and can't do. It's about balancing that with what airport security can do, but also recognizing that interpersonal difference of opinion and request. And that can be quite tricky to balance, but that's why we needed to all come together to hear all those different perspectives from airport security, industry, clinicians, researchers, and most importantly, the people living with diabetes, so we could all learn from each other. Because again, one of the best things about this was just like our working party has just highlighted that you cannot design a policy if you're just doing it with airport security, because a policy won't just affect airport security personnel. That policy needs to be designed collaboratively with all voices at the table. So that's probably the big overarching gap. The way things are managed in many airports have been managed without all voices coming to the table. And so that's why we used the consolidated framework for implementation research to help us understand how to bring all those voices and perspectives in a harmonious way to achieve that. One of the other challenges or gaps, if you like, was the resistance from the individual industry folk, so your different diabetes technology companies. There has been hesitancy for the different industry companies coming together. They want to protect their own products. That doesn't necessarily, AMSL might not align with Abbott, which might not align with Medtronic, which might not align with Ipsomed, Insulet. So trying to bring that all together is tricky because they've all got different algorithms and they've all got different recommendations. So it's trying to align that as well. Probably another gap from a clinician perspective is the way that clinicians are preparing people with diabetes. You Google diabetes and travel, and this part of the step very early on was done with Diabetes Victoria and advocacy, obviously, there. We Googled diabetes and travel, and just so many resources came up. A lot of them were all very blurred, and they all said the same thing, but just in a different way. And then some other documents came up. It's like, well, that contradicts that resource and that contradicts that resource. Why can't we just have one central hub? People just go to one central hub that's facilitated by, say, your overarching organisation like Diabetes Australia or NDSS, the National Diabetes Services Scheme, because then that reduces the risk of confusion and the mixed messaging. And if you can't crunch down on that mixed messaging, that then goes out into social media and peer support groups, and that just causes a whole hoo-ha, and that leads to distress.
Thank you so much, Delinda, for speaking about that with such passion, with understanding, because I believe that we are setting the precedents not just for Australia or for developed countries. People from different countries, if they want to step up, they want to see how they can also deal with these issues, deal with these situations. We look at other countries that have done the similar thing. So I think we thank you so much for using that perspective, even to include people living with diabetes, to say, yes, it's not just we are not blaming anyone. We're not blaming the airport security, but maybe you're not prepared enough for that. Even the healthcare professionals, in a way that you are preparing people living with diabetes to say, how do you deal with airport security? Maybe it's something that they never thought about when these things were introduced, because it's been ages since these things were introduced, but we are now starting to talk about it now. So what was the situation then? And I know that there have been so many issues that were undocumented, which were really emotional, heartbreaking, but we never learnt about that. It's only those things that were documented that we start to talk about. So thank you so much for speaking about that with such understanding and passion. And I hope that your journal, your research papers would be published, and then people would have this recognition to say, yeah, we don't have to duplicate. Let's just use one thing. Let's not introduce something that will contradict with anything that is there. And then people will be like, okay, so which one is superior? Which one should we use? Because there's so many different papers, so many journals, so many consensus statements that are out there. Let's just use one thing. As we go to Lauren, because you're a researcher yourself and also you're a person living with diabetes from Australia, what are people living with diabetes across Australia saying about the experiences at airport security? And I know that in these discussions, as you're trying to shape up something, a national plan in Australia, you're also involving people living with diabetes. And I know that you are really passionate and you're super engaged in this project. So if you could tell us, what are the people living with diabetes? What are they talking about? What are they saying? And what are you saying as a
Yeah,
person living with diabetes?
the online Facebook groups that I'm in, I always say you don't have to scroll very far to see, like, to come across a negative airport experience related post, unfortunately. They are everywhere because people with diabetes are traveling, and because I feel like there's not much consistency and around what approach airports are taking. Obviously, everyone living with diabetes is different, so how they want to tackle airport security is different as well. So even for myself, like when I'm traveling, sometimes I will go through the body scan and go through airport security, not declare that I'm wearing any devices. I'll just go through, wait for it to come up on the screen, and then have to pat down or whatever it is that I'm going to get. Whereas other times, if I'm feeling, I want to say, like a bit braver and a bit more confident, I will tell them from the get-go that no, I'm wearing an insulin pump, I'm wearing a diabetes device that can't go through that scanner. I'd like to have a pat down, please. And because I know that the response that I get from the airport security staff member, it's not a uniform response. It honestly, I feel like it depends who you get on the day, what kind of day they're having, how much they know as to what kind of response I'm going to get back, and whether it's going to be positive in that they are happy to follow my lead and to not force me to go through the body scanner, or if they're going to push back and say, no, it's fine, you can go through. Like, people go through that hundreds of times a day. People with diabetes go through all the time. It's been tested, it's fine. But I don't know that for sure. Like, I don't particularly trust that airport security person to keep my diabetes in my state, so they have no idea what diabetes is half the time, let alone what a device is half the time. So that's my personal experience with how I tackle airport security. Yeah, honestly, I hardly ever read anything positive about going through the airport on social media. It's not that it doesn't exist, that people don't have a positive experience, because they do. I know that they do, and there are positive experiences being shared out there. And I honestly think it just comes down to airport staff listening to the person living with diabetes, listening to their needs, acknowledging their travel data if they have one, and just and working with the person, showing a little empathy, showing a little kindness. That's all it takes. Well, that's not obviously what all it takes, but it seriously goes a long way. And I think if people have a bit of empathy and a bit of kindness, even if they are still trying to push that person to go through the body scanner, whether that happens or not, I think that can really shape that person's experience when they're traveling to whether they feel heard or not. But yeah, largely it's negative. I think largely people are still being told that they can go through body scanners, which is the norm in Australia these days. It's all still a bit of a mess.
Thank you for that, Lauren. Have you seen like notable differences between states and territories, considering that you and Belinda are both from Victoria, and it seems
No,
like
no, no,
I only know of people in Victoria who are working
no,
on
no.
it.
So I'm from Victoria and Lauren's from Western Australia. So we're on different sides of the country.
All right. Well, I think this
Yeah.
is interesting. Thank you so much. And I think maybe what I could share from my global perspective, as someone who has been fortunate enough to travel a lot, I think what I've seen, like on how do airport security protocols, how they vary in other countries, especially dealing with medical devices. Yes, I would start with, it's very unfortunate that I didn't carry my paper line yet. It's something I know. If I'm in Africa, if I'm passing through border controls from Africa, I don't even have to wait because nobody knows about it or they pretend not to pay attention to it. But whenever I'm in Europe or other countries, developed countries mostly, then I put it on because everyone was looking at me now. I'm like, do you need assistance? I'm like, no, maybe what I would want to ask for a pay down because some people, I think the responses that I've been getting with, who have seen other people wearing those medical devices, they've been passing through this body scanner. The thing is, they're not aware of that. Because I heard from somebody who was wearing a CGM, she went through a body scanner. Because she told me that, when I went through a body scanner myself, I just ignored it. But a few hours later, my CGM was gone. It couldn't respond. It was no longer working. Then I had to replace it. Thankfully for them, especially for people in Europe, I know. For other countries that don't fund it, like I know in the US, I don't think it's funded like it is in Europe, where the governments are funding for the CGMs. They said, yeah, of course, I had the backup, so which was a good thing. Many times when people are traveling, they always have to pay more than enough, more than what is enough for them, even if you know that my CGM will expire in the next 15 days. But though I know that my visit is just for 3 days, I always have to have a spare. Not that I'm expecting, I'm looking forward to seeing my CGM fail. I wouldn't want it to fail when I'm dealing with a lot because there's a lot happening, especially with changes in time zones. Sometimes you need to change the time that you take your medication if you're injecting, like if you're on a multiple daily injection. But if you're on a pump, you only bolus when you need insulin, right? So which is fantastic. It's easy for people living with diabetes who are using those things. But then I think at airport securities, yes, it differs, especially in Africa. We are taking time to get to that. We are not yet on those stages that you guys are now. When it comes to airport security, because not everyone will be able to understand it. If they don't understand it, some people might not want to give you that pet down or to give you grace because they haven't seen it before. You're the first person that they're seeing you with this thing. And for them, I don't know, do they have to see it first for them to be able to understand it? I don't know. Because probably you're the only one or the first person that they've seen wearing these medical devices. So I know even for you, Belinda, even for you, Lauren, when you see someone not being handled in a proper way, even if you're just seeing it, you're in the queue, you're waiting, and then you see that there's someone with diabetes who is actually going through that, you'll be like, oh my God, I wish they knew this. And sometimes you'd feel like you want to intervene so that you can help that person because they cannot fight for themselves. So some people will just give up to say, no, I don't want to argue. If they don't want to listen, if they don't seem to understand me, then I don't have to argue with them because I've seen it. I think that was in Kenya. I think it's good that I'm actually calling them out on this podcast. They did it to somebody whom I knew. She was from Ghana. She had a CGM, but because she couldn't explain it herself, she didn't have a later to to help her to explain, to validate whatever she was saying, the claims were accurate or were correct or medically backed up. She didn't have that. For me, I had it. Then I had to show it to them. She actually passed. She was, I think, five people ahead. So when they saw me with that, they said, no, 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 we need you to remove. Then I said, no, I cannot remove it. I could actually die. And also, I had my juice. I was actually drinking my juice. I said, no, I'm not even leaving my drink here with you. I have to drink it because my blood sugars are low. Then they said, well, we've never done that before. Then I said, yeah, you can make an exception because I was really patient. And then they were like, okay, fine. We'll just give you grace. We'll let you pass. They read the letter. It was so wordy. It was 2 pages. They couldn't even read all everything. But then because I had a letter with me, I know that he was so tired. He was exhausted. He couldn't even read it. He just looked at it and said, does it have a signature? Does it have a stamp? Does it say anything about a hospital? And then they just allowed me to pass. But I know dealing with these things is difficult. So thank you for people like you who are actually doing research, people that are challenging these norms, because with whatever it is you're doing now, it is going to help us in the future. Maybe not now, but yes, we are still experiencing these differences when you go to different countries. But it's something that we know that actually is going to work. So thank you for all that you're doing now, because so that we don't have to go through those things that people went through. I don't know what you went through before, Lauren, dealing with this, living with diabetes, or I don't know what the stories you had, Belinda, from the people that come to you, to your clinics. I don't know what they told you, but I know this is something that we're still experiencing. But I think it's going to the norm, but not in Africa because we are not there yet. We don't have CGM. There are not so many people. Maybe it's one in a million or one in a day. You could, or maybe in a week, they might not even see one person with a CGM. But yes, these differences are still there. But I think it's good that we're going to have, if we have a one global consensus statement that we could just use, not to say we have an Australian version, we have a UK version, a Zimbabwean version. It would be confusing. But when you go, whenever, like when I was in France, they said, yeah, we understand. We know CGMs. Yes, of course, we understand. Okay, we don't want to go through a body scanner. We can do a pay down. So that was so good. And then I was like, yeah, at least they know these things. I was like, I wish our people knew this. I had my people lanyard with me, then they understood it. They wanted to save me first. But I felt bad because there were other people who were actually running. They were saying, no, 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 the gate is about to close. Can you allow us to pass? Then I couldn't say. And then I said, nah, I'm good. I still have ample time. I was like, I think I had about 6 hours. Then I said, no, 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 no. I'm not in a rush. I'm not in a hurry. I'm okay. Let me be. So, but I still had my paper lanyard on. So, but I think if we continue to talk about this, calling these things, writing a journal like this, I think it's going to help us to frame this better so that whenever we in danger or we are in need, we can just go on the internet. This is the statement. This is what we are using. It's an international statement, so everybody has to comply to it, right? Because it's a matter of life and death. Imagine being told to remove your pump, and it's the only one you have. Probably the spare that you have is in your checked-in luggage, and you are going to see it tomorrow. Then what's going to happen? It's going to be trouble. And I know that there are people who might have gone through this. It's really sad. So as we go,
So what
Big
you're
dream is to have an international consensus statement that every airport has to follow and every stakeholder that's involved has to follow and be part of. That would be the dream.
yes,
We'll get there.
together.
and a lot of things in diabetes care and education is very difficult to become universal because a lot of different settings, community, cultural, clinical settings are quite contextually different. However, stories that you've just shared, Tino, the stories that Lauren shared, the stories that I've heard, the underlying themes are actually very, very universal. And it's not actually about the diabetes device. And actually translating that into the airport security space, and whether they've got a diabetes device or a cochlear implant or a stoma bag or a pacemaker or any other medical device, it's actually about just upholding really solid interpersonal skills, interpersonal communication, listening to the person, acknowledging what they want to do and giving them choice.
Nailed it.
I couldn't have said it any better, or even if I knew about it, but I didn't know about it. So thank you so much for that, Belinda. I think it's really great. I think adding to what Lauren said, I think I have a question for Belinda, something that is very critical, considering stakeholders' involvement in this. Why is it essential for all stakeholders, airport security, healthcare professionals, industry, the diabetes community to work together on this issue?
Because we've all got a role to play. The person with diabetes will come to their health professional for advice on travel. That health professional needs to know what to do in a uniformed way so they don't provide that one person with information that then that person with diabetes can go away and share with, say, their peer support group, which might then raise mixed messaging because another health professional has told another person in that peer support group on quite a different way to do it. So we need a range of choices that the health professionals can offer people with diabetes, but they're the same range of choices. We're not offering completely different choices that some people have never heard of, because that's where the confusion and mixed messaging and then therefore the fear comes from. We need those pieces of information or those resources that the clinicians are going to share with the people with diabetes to have been made up or created in collaboration with the industry and the airport security staff. A health professional can't provide advice on airport travel if they don't know anything about what your different screening methods at airports do, which is probably a nice segue into what Lauren does at Perth Airport with the advisory group that she's on. And so perhaps she can talk about how that advisory group and her role in that is actually helping to bring those voices together and keep everyone on the same page to reduce that fear, confusion, mixed messaging.
Well, thank you so much, Belinda, for sharing that. Yes, I think it's really important that these things get to be done. For you to get to start to work on these projects, there are people they're paying attention to what is happening around them. I think maybe in Australia or other developed countries, you get to see that there's always a diabetes community that is super engaged. They're involved already. They're working closely with healthcare professionals, not just for a certain thing, but on a number of things, which is good because it's something that was already being done. But mostly in Africa, it's not a normal thing. Even if you're a professional in whatever area you're a professional in, when you go to a hospital, when you are talking with your healthcare professionals, whenever they see you, they're seeing you as their patient, right? So I'll be like, what can we really work on, really? But it's something that is starting now. It's not a common thing to see healthcare professionals sitting together with people living with any healthcare condition to discuss about something, to say, how can we work on a policy? What can we really do? Because it's something that they're learning when they, especially those that have the opportunity, who are exposed enough, who get to attend conferences, they see that even people with diabetes are working closely with healthcare professionals. And look what they have achieved, especially for countries that have achieved so much, people that have done so much. I know that for people living with diabetes who are also involved in this project are going to be mentioned to say, yes, this was not only done by healthcare professionals and researchers, but also people living with diabetes who are also involved in this. So thank you so much for that, Belinda. Lauren, the question that I would have for you, I think it's quite similar to what I've asked Belinda, but how do factors like access to allied healthcare professionals, certified diabetes educators, hospital teams, or peer networks affect how prepared travelers with diabetes are for airport security? If you could share that with us.
I feel like it depends on the setting and the clinic and who that clinician is, and I will talk about what I do anyway. So I feel like I really help to bridge the gap between clinicians and people living with diabetes and stakeholders like the airport. So I'm not a clinician, I'm not a healthcare professional, I'm not an allied healthcare professional by any means. I live with diabetes and I work in that space, and I'm kind of like the middleman between clinicians and people living with diabetes, and I'm telling clinicians what the people living with diabetes need, and people living with diabetes are telling me what they need from their clinicians. So it's a beautiful spot to be in because I truly get to make a difference and to feed that back to the relevant parties around what each party needs. And that's really important in this airport security project because it's not just we need to train one person or one particular party. There's so many people involved that need to all be on the same page and that need to all be working together if we're going to make a difference in this space. So I'm really lucky in that where I work at PDC, our clinicians are incredibly passionate and dedicated, and they will do everything that they can to make sure that their clients are well prepared for traveling with diabetes. And if their clients come into any trouble when traveling with diabetes, they have people like me who can report it back to Perth Airport, or I'll even happily report it back to other airports to say you need to do better, or this has happened, what can we do about it? Or, for example, with Perth Airport, if we see a rise in complaints, or either from Perth Airport's perspective, if they see a rise in complaints from people travelling with diabetes, or from my work perspective at PDC, if we hear a lot more complaints from the community around getting through the gates at Perth Airport, then I can go to my contact at Perth and say, we need to have a meeting, we need to discuss this, we need to get back on top of it, make sure that we're doing better. Then obviously have my regular advisory group meetings with them as well. But I think Perth is the only airport in Australia that does the airport advisory and inclusion and access kind of groups really well and consistently. I think other airports have the groups, but they don't do them regularly or consistently like they do in Perth. And in terms of clinicians, some clinicians will just wipe their hands clean of people living with diabetes travel and do not do much to support them. So, like, some people will get a travel letter, others won't get that. I know, like at PDC, if people are traveling last minute or they forget their travel letter, they can ring up and our clinicians will write them a travel letter and send it out to them. Whereas I think other places, if that happens, they're stuck with their GP if they're lucky to write them a letter. Yeah, and others will talk about how great their letters are and how they have their client has no issues going through, and others will probably provide a poor kind of letter that isn't helpful at all going through airport security, which again is why like we need something standard. We need a standardized template for an airport travel letter that actually is going to make a difference when you're trying to get through airport security.
Thank you for answering it. That it's not something is just happening out of nowhere. Someone is doing something somewhere. Someone is advocating. Someone is researching. Someone is having sleepless nights. We're talking about this, yes, in the middle of the night already. Probably it's midnight. I don't want to talk about that, but thank you, ladies, for being giants, for being amazing to talk about this. Yes, I think we have done with asking individual perspective. But now I think we want to jump straight to the Australian National Project Global Scalability. I would have wanted to start with Belinda, but this is something that Belinda said I should ask you because you're doing something about this, Lauren. You're closely working with us. And then after that, I'm going to ask Belinda a question from what you would have said. She's going to build up from that. Lauren, if you could walk us through some of the key objectives of Australia's national projects and how it's improving airport security for people living with diabetes.
We knew that we needed a national project because you don't just fly in and out of one. Like, I don't fly from Perth to Perth. Like, people fly from all over the place, like not just in Australia, obviously, as well. But if we were going to be able to have some momentum and really make a difference with this, we needed to make it national, and we needed an overarching kind of body to help us. And enlisting the support of Diabetes Australia, that really added extra credibility, and it ensures that the project can keep going and can maintain momentum, because just for Belinda and I to do this ourselves is very difficult because we're both juggling like full-time jobs and lives outside of this, but we're both incredibly passionate and want to make a difference in this space. So getting Diabetes Australia on board was really good because the national peak body for diabetes in Australia, they have resources and connections that we don't have, and they can oversee it all and kind of run it with our guidance. And it's been really good because we've been able to establish a large working party that isn't just people living with diabetes or isn't just airport security staff, like it is those people. So people living with diabetes, it's airport security staff, it's government bodies like the Department of Home Affairs, it's representatives from each airport in Australia, it is clinicians, it is all sorts of people. There's probably several people in there that I've missed, but that's a bit of an insight into who we have involved. We've got everybody that needs a seat at the table has a seat at the table. And it was important to do it from a national perspective because we needed to bring everyone together and have a unified approach. And then if we can do that well in Australia, that cross-sector coordinated collaboration can then be replicated internationally. And hopefully we'll start to see that global international consensus around diabetes travel and how we support people with diabetes getting through the airport. It's about making sure that other countries don't have to reinvent the wheel when it comes to this stuff as well. Even if that means, like, for in Africa, if they don't have to, if they're not going to think about this for another 10 years or something, at least when the time does come that they need to implement, be ready for people traveling with diabetes and their devices, there'll be something in place for them to follow and for them to apply. If we have a national approach and we have everybody working together like this, then it makes the process that people will experience at the airport streamlined, hopefully. So it'll hopefully mean that people traveling with diabetes will receive a safe, predictable, and supportive screening experience no matter where they travel. So it'll start with, ideally, no matter where they travel within Australia, and then that will ideally expand to globally. So when people are traveling outside of Australia, they'll receive the same treatment, and it won't be different rules for different countries. It'll be all the same. Everyone will know what to expect, and that will take so much stress away from people traveling with diabetes.
Fantastic. And I think already you sort of like touched on the next question that I wanted to ask Belinda. So thank you for sharing those key objectives of your national plan. That is amazing. So now I think we would want to make it global. That's why we're talking about it. Belinda, yes, as a key stakeholder in this project yourself. So how can this Australian model be adopted globally without maybe every country having to reinvent the wheel? That's Lauren's word, without reinventing the wheel. And how can we avoid these mixed messages and duplicated resources?
Basically starts with just opening up the conversation locally in your own countries and having those community consultations. And that's not opening up those conversations to reinvent the wheel, but just opening up the conversation saying, this is what Australia's done, or this is what the UK's done. Hopefully, we are working on a paper, Lauren and I, that we hope to publish. And then, having that paper there, another country then go, here, read this, this is how they've done it. And you can take the general template of what we've done and apply it to the different countries, but even just the different states in some larger countries as well. Not everything is going to be exactly transferable to other countries, but the foundations are there. And I think the main mechanism, if you like, that can help scale up what we've done in Australia to other countries is the fact that we've used the CIFA framework, and that's the Consolidated Framework of Implementation Research. It's a implementation science framework. It's well known across the globe. It can be applied. It's a theory that can be applied, or a framework that can be applied to many different contexts, not just airport security and diabetes devices, but it's the way that it's constructed and all its domains that it incorporates is based on understanding the barriers and facilitators to certain situations, because you're understanding those barriers and facilitators in a different context that can then, I guess, operationalize the foundations of what we've done in Australia to the next country. And then that can go to the next country. Does that make sense? I think the paper itself, it really does tell the story in a very structured way because of the framework that we've used. And I think a lot of other countries, it will make sense once they've read the paper.
Well, thank you so much.
Really, I've created a lot of suspense for people waiting for this paper.
Thank you for doing that and also for being diplomatic. Thank you for even inviting other countries, even to say, yeah, they can use the templates. Yes, maybe what you have structured in
Yeah.
Australia might not be applicable everywhere, but yes, they can use the genealogy of it. Because I know that it's not every other
Yeah.
country that is going to take part in this. People just want to use what is already established, what is already there. Because some of our people, some of our healthcare professionals, they are not motivated enough, they're not paid enough to be able to challenge such narratives. They just want to use what is available to them. They don't want to challenge. They don't want to do
Well, they
research.
don't have the resources.
They don't have the
They don't have the
resources.
resources. Or they don't
Yes.
have the skilled specialists. They've got generalists. Yeah, so it will give that.
Especially for a condition like diabetes. We have seen like many of them. It's only very few fortunate medical professionals who know about CGM. Some have never heard about the talk of it or seen it before. So for them even to advocate for it or to talk about it, do you think you're going to be able to continue? Because if you are to talk about the use or the efficient of any machine or whatever that you're using, we first have to look at be able to sustain yourself with this, because you cannot just use it once and say we want to advocate for something that even in your country is not even available. It's not being sold in your country. It's not available in your market. For those that have it, maybe it was through other channels. If you have family in Australia, Thank you for making it amazing. And hopefully, so many people are going to also get access to the journal, to the paper that you're going to publish and use it as a template. We are going to look at it. Maybe now, as we jump to the last segment of our podcast, which is the global call to action. This is something that I've seen happen before, but maybe something that you didn't talk about or something that you didn't mention in this framework. But maybe I would want to ask you about something interesting. Would you think like a global position statement or a framework would help to unify these best practices for airport security and diabetes?
I feel like it can't hurt as long as people, like, we have every stakeholder involved and people actually implement what the statement is about rather than just viewing it, signing it, and it's just a tick box initiative. Yeah, don't want it to just be a tick box initiative. Like, people actually need to properly have something that they will implement and keeps them accountable. Yeah, I know I keep saying, like, yes, let's have like a global
Position
position
statement.
statement or like
Mhm.
global kind of protocol that people follow. You definitely need something.
There's no reason why IDF, the International Diabetes Federation, so for our country, Diabetes Australia is the logical facilitator of our particular national working group, but there's no reason why IDF can't take this on board. They are the international peak body for diabetes. Countries will go to them for clinical guidelines. There are a lot of countries that go to ADA for clinical guidelines, but a lot of clinical guidelines in the Northern Hemisphere can't be translatable into the Southern Hemisphere. Whereas this, it's not dealing with, yes, we're talking about diabetes devices in different countries, different access to different devices. But as I said earlier, this topic is not too much about the diabetes device. It's about how people want to be treated. As researchers, industry representatives, policymakers, government officials who have worked alongside those people with diabetes to understand what it means to go through airport security with diabetes devices so that they can back that consensus statement. And it's that will make that consensus statement scalable to other countries. So that's why it needs to come from IDF.
Thank you so much for that. And I think also ISPAD, they did something that is very amazing. Many people have seen it, especially for people in school. They drafted like a position statement for schools, something that is so thorough. People are still using it. It talks so much about the support that people should be getting at school. Yes, some schools might not be in a position enough to employ healthcare professionals and say, yeah, we have a school nurse, we have a school clinic. At colleges, yes, we did have that. That was amazing. Boarding schools, they did have a clinic that is supposed, but at other government schools at that level, they might not be in a position to have healthcare professionals that are just working there. Of course, if you get sick, you need to be sent home and then your parents have to take you to a clinic. That's how it is. That's the system. But yeah, I think it's something interesting. One pillar of strength for any diabetes organization is to do advocacy, advocate for people, meet people where they're at. I think I love that statement. You don't have to wait for them, but to meet them where they're at. You don't have to wait for them to come to you to say, can you talk about this? Try to identify those things that are interesting. That's even what makes us to want to come to you to say, yeah, of course, you're talking about these things as yes, the world is changing, so many things are happening, but are they even talking about the things that affect us now? Not about what was happening in the past. Not to have this bureaucracy that it has to be signed by someone before it can be talked about. It's at global level, at global stages. Let's talk about it now. The last question of interest that everyone tries to ask, we want to talk about it now. How do you think we can make the statements or this global position statement? How can we ensure that it's going to be actionable and that it's not just words? Because there have been so many position statements, we don't see the implementation side of it. But how do we ensure that this is going to be actionable and not just words that will just be buried there and ticking off the boxes, like Lauren said?
I think that's probably harder than advocacy itself.
Okay.
And how hard is advocacy? How hard is advocacy? And those of us that do advocate are often, it's a very slow gain. It's a lot of energy can burn out from advocacy. I think it's about, again, it's not even about the topic of airport security and diabetes devices. It's coming down to we have picked up in our project, particularly in the written paper, through using the CIFA framework. It's about those, how do all those interpersonal differences in the stakeholders come together, and what are the roles of all those stakeholders, and how do we back each other, and how do we elevate each other, and how do we keep each other going, how do we drive and just keep collaborating. I think that's the part that's easier said than done. It's those soft skills that are the most important skills, which comes from people power. It's also acknowledging that the UK has done some work in airport security. I know Anita Sabiti in Indonesia is doing some work, and there are probably other people as well. And there's definitely stuff in New Zealand, because I had an experience in New Zealand just recently in Wellington, and I was super impressed. I was going through security, and I had a great yarn with the airport security officer, and he was all over it. But he also said, it's just about listening and being aware and acknowledging what that person needs. It's not rocket science. You don't need any fancy intervention to make this happen. We just all need to be on the same page and keep backing each other. It's a hard question to answer.
There's a lot of elements involved.
Yeah.
You're right, like it needs consistency and it needs people backing each other. So maybe it needs like a global group of lived experience representatives and like clinicians, and a bit like the National Working Party group that we have here in Australia, how we have all the different stakeholders involved. So it's not just people living with diabetes, it's not just airport security staff, it's everybody that needs to be involved is involved. Having that on a global scale, because then like you can work together to monitor what's happening in different parts of the world, and you can collate feedback from all different parts of the world, and everybody's going to have different connections and different opportunities to engage with airports and regulators and like airport associations and things like that. And different countries will have different tech coming out at different times, and the more people that you have without it being too many working on it together, the more accountability and the more momentum you can have. And like if it was just Belinda and I still doing this, it wouldn't still be happening because we would have been burnt out. So if you have a bigger group of people, then at least you can share the load with each other as well.
And a bigger group of people that has a facilitator, which is why we
That's why
requested
DA is so important.
Diabetes Australia to become involved, because you need them to not keep the momentum going, but to circle back, because it's the circle back and the checking in to make sure that we're still progressing, so that we are striving towards that implementation and actually actioning that implementation.
Yeah.
Bravo. Well said. Well said. Thank you. I wish this was streaming, as many people joining to ask questions, to applaud on their own, because now I'm just applauding for them. But I know that they're going to be amazing, amazing feedback coming. So thank you so much. If you could deliver one clear message to airport security or airport authorities, policymakers worldwide, what would that message be? Okay.
I think the common theme that came through our work, where we've used the CIFA framework and has come through in our paper that we've written, no matter who you are, clinician, airport security, policymaker, government official, industry representative, remain humanistic, not sort of time focused or system driven.
Yeah, I would just add be kind and listen to the person. It takes not much time to show a little empathy, and that's going to make such a big difference in that person's day and that person's experience. A little kindness and a little listening goes a long way. You can really make or break someone's travel journey.
I wish I could have my own last words, but these are amazing. Thank you so much. Yes, I think my take-home message is that be compassionate, listen to people, be adaptable. Yeah, of course, things are changing every day. Just be kind to people, because you don't know what they're going through. You don't know what they're traveling for, where they're coming from. But if you ask them to take off a CGM, a pump, their life depends on it. Our life depends on it. So thank you so much for your involvement, your engagement. And I don't know if you have any last words of your own, of things that you feel these might have been important. Tino didn't ask me this. This must have been important. Or our question didn't really get to address that. This is your time. What are your last words?
If anyone wants to open up the conversation to do what we've done, happy to collaborate, because at the end of the day, we're all in it together. It's a small world, the diabetes world, and it's not what you know, it's who you know. Let's keep the conversation going. Let's back each other. Let's collaborate and build on what's already there rather than reinventing the wheel.
Yeah, I can vouch for Belinda there. We are often talking about how much we would love to see the diabetes world collaborating more together. So, yeah.
Wow.
What she said.
Wow, what she said exactly. Thank you so much for saying that, Belinda. So, as we wrap, so one message stands out clearly. Safe air travels for people living with diabetes is not an optional courtesy, but it is a global responsibility that all of us should get involved. People with diabetes get involved to talk about this. Let's continue advocating for ourselves. Maybe it's not going to help us now, or maybe we are not going to face much of the challenges, but also we are doing it for the future generation so that we are not always having arguments for years and years and years. It has to come in time when people say, oh, okay, if you see someone wearing this, you don't have to ask them to take out their medical later from their doctor supporting later. You don't have to ask for the same thing. But if you want to check drugs, are they transporting anything? Just do your pare downs and swab anything and everything that you feel is necessary to swab. But please don't ask people to remove their medical devices. And I know as people who are also contributing to this journals, national plan in Australia, you're hoping not to see these things happening in the next 5 years. We want to talk about new things, right? So I think the consistent protocols, informed staff would help us a lot, and collaboration across airports. The healthcare teams, industry, people, the diabetes community itself is really essential to have that collaboration. And I think what is happening in Australia is something that is commendable. Australia's progress shows us the solutions are possible if we continue to learn, to pay attention to what is happening around us. I think that's going to help us really to go far. Our hope is that this discussion sparks the unified action and it leads to a real change worldwide and to every airport authority and to all people living with diabetes, policymakers listening. People's safety depends on the decision that we make next. So thank you so much, Belinda. Thank you so much, Lauren, for making your time to be doing this amazing, amazing work. And I believe that it's going to be fantastic to the people that are going to receive it. In German, they say fantastisch. So thank you. I enjoyed, and I know that the community is going to love this so much.